Thank you for the presentation, and actually perfect pronunciation of my last name, which is rare. So I'm from the Department of Orthopedics at the hospitals of Kristianstad and Hässleholm in southern Sweden. I will start my residency at this department in 2 weeks, so today I'm still an intern, and also recently began my PhD studies at the University of Lund on Dupuytren Disease. So it's a great honor for me to be here today and present our research regarding the pain aspect of collagenase treatment. And since I'm both new to research and the profession itself, I do not have anything to disclose, but my co-author, Dr. Atroshi, has, as you can see on the slide. And as we all know, collagenase injection is being increasingly used for treatment for Dupuytren's contracture. In our department, it is the first method of choice, and we have treated 475 patients since the start in 2011. We know that the finger manipulation procedure is painful, and therefore you can say that it's a standard method to use local anesthesia before the extension procedure. However, is the collagenase injection itself painful? Our experience is that we have noted that patients seem to experience substantial amount of pain at the time of injection. So the objective of this study was to determine if there is a benefit of injecting a local anesthetic before the collagenase injection. So we used 162 consecutive patients at our department scheduled for collagenase treatment, with our usual inclusion criteria of an extension deficit of at least 20 degrees in the MCP or PIP joint and the presence of a palpable cord. We have specific sessions for collagenase treatment with, at this time, 9 patients every session. And we quasi-randomized these patients into 2 groups by alternating the groups into an LA group and a no LA group, where the LA group, of course, got local anesthesia 20 minutes before the collagenase injection. And in our department, we use a modified injection method. There's only one surgeon who treats the patient, and he shortly injects the collagenase into multiple spots in the cord. We used mepivacaine as the local anesthetic of choice, diluted by sodium bicarbonate, since it, according to some studies, decrease the pain experience from the local anesthesia. And to assess the pain, we used a visual analog scale, which you can see on the picture, a 10 scale with 0 equals no pain and 10 is worst possible pain. And at the time of the first injection, whether it was local anesthesia or collagenase, we asked the patients to rate how much pain they experienced on the VAS score. And then when they got back 1 or 2 days later for the extension procedure, we asked them again to rate their pain that they experienced at home between the 2 visits. Here's the technique of the finger blockade in the proximal palm. And VAS score is a subjective score that you can assess pain with. So we looked into studies to see what difference you would have to show a clinical significance. And we found in 2 pretty large studies that 1.3 in difference in the VAS score is clinically significant. And by that we estimated sample size to be 50 persons per group. We then calculated the mean value and standard deviation of the patient-reported VAS scores and used covariance for adjusted analysis. So this is our results, where we can see significantly lower mean VAS scores for the group that got local anesthesia 20 minutes before the collagenase injection, with 2.3 in contrast to a mean of 4.3 for the no LA group, with a mean difference of minus 2.1. And when you compare how the group experienced the pain at home between the injection and manipulation interval, it was the same, 2.9 for both groups. Here are the results more clearly on the diagram. And our conclusion is that you can reduce the pain that the patients experience during the collagenase injection by using a local anesthetic before. And based on this study, we used local anesthesia routinely in our clinic. Thank you very much.